Are you frustrated with your psoriasis returning no matter what you do? Psoriasis is often thought as a skin disease only, something you can hide, something cosmetic. But the truth is, psoriasis is a long-term disease that begins within the body and not just on the surface. Psoriasis affects approximately about 1% of the Singapore population, meaning about 40,000 people live with it. For many, it impacts more than just their looks. It can impact sleep, confidence, relationships, work, and quality of life. Today, we'll talk about what psoriasis really is and how it is diagnosed, treatment options, and more specifically, how biologic therapy can help patients with more severe psoriasis achieve better control. Psoriasis happens when the immune system goes into overdrive and sends inflammatory signals to the skin. Typically, skin cells renew once a month. In psoriasis, this process speeds up dramatically in just a few days. The skin cells don't fall off as quickly as the body regenerates them, so they'll build up on the surface. And this often results in the thick, red, scaly plaques that we usually see. Symptoms of psoriasis may include patches of red inflamed skin that may be covered with silvery scales, itching or burning, cracked or painful skin, or scalp or nail involvement. It may also cause pain and stiffness of the joints, which is otherwise known as psoriatic arthropathy. The diagnosis of psoriasis is usually made by a dermatologist. We will evaluate the skin involvement by its appearance, locations, and severity. We will also look for symptoms such as itching or joint pain. For mild psoriasis, treatment often begins with topical creams, such as steroid creams or vitamin D-based creams. Some patients may benefit from phototherapy, which uses controlled UV light treatment to lower the inflammation of the skin. These options may be effective for mild disease, but some patients may still experience persistent flare-ups. When topical creams alone are no longer providing adequate control, a biologic may be an option for patients with more severe psoriasis. This may include patients with large surface area involvement, recurrent flares, and those with substantial impact on their quality of life. Biologics are targeted medication that block specific inflammatory pathways in an injection form, and this can be administered either in the doctor's office or at home. Traditional treatments generally suppress inflammation, while biologics target these specific immune pathways that are driving the process. When deciding to initiate biologic, factors such as lifestyle, medication history, and treatment goals are considered. Choosing the right biologic is highly individualized. There are different biologics that target different inflammatory pathways, and the right option often depends on many different factors. For example, for women with family planning needs, a careful discussion with your dermatologist will be required. For many patients, biologics can lead to a substantial skin clearance and improve symptom control. Patients may have reduced plaques and scaling, and therefore have a much better quality of life. But patients respond differently. The biologics therapies that we have today have changed expectation for how psoriasis should be treated and have allowed many patients to achieve much clearer skin than is possible in the past. Like all medications, biologic must be assessed and monitored by a qualified doctor. He or she may look over your medical history and run tests before you begin treatment. Close monitoring during the treatment will also help to ensure that patients respond well in a safe manner. If you or your loved ones is suffering from chronic psoriasis, it may be time to speak to a dermatologist about treatment options available today. Biologics and other modern therapies have greatly improved our options now. The right treatment plan can help you or your loved ones get better long-term control and quality of life.